What is a quadriceps tendon rupture? How does this devastating knee injury occur? In this video, I'll answer those questions and discuss current treatments for it to help you recover. My name's Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. Now, quadriceps tendon ruptures are not exceedingly common. They do happen, but they're not nearly as common maybe as patellar tendon ruptures, and even those aren't terribly common. Now, if you know anatomy of the knee, try to get my hands out of the way here. This is the kneecap. The patellar tendon is the knee, or is the tendon below the kneecap. The quad tendon is above the kneecap. It connects the quadriceps muscle to the patella. Patellar tendon ruptures typically are in younger patients in their 20s or 30s. Quad tendon ruptures very often older 30s, 40s, things like that. Now, the mechanism is very similar, some sort of eccentric load, usually from a fall or an awkward landing. So you do see them in sports like basketball and some others that cause that. Now, when that quad tendon ruptures, it becomes exceedingly difficult, if not impossible, to perform a straight leg raise. Basically, there's nothing connecting your quads to your patella or lower, so extending your knee, or if you're laying on a bed or couch, lifting your whole leg off the bed or couch would be just about impossible. These are injuries that have to have surgery. A complete quad tendon rupture would not heal on its own. I mean, I suppose you could put somebody in a knee immobilizer or a hinge knee brace, lock it out straight, and maybe it would heal then, but then your knee would be so stiff you couldn't use it once that tendon was completely healed. So this is an injury that orthopedic surgeons fix surgically. They go in with a variety, whether it's just sutures and drill holes through the kneecap or maybe suture anchors, go in and reattach the tendon. See if I can show it to you there. Reattach the tendon to the top of the kneecap. Now, that surgery is an outpatient surgery and it's got good success rates, but it's a long recovery, a lot of time and a lot of work with physical therapy, getting your knee range of motion back, and then a lot of time and work getting the strength back and some of the physical activities and functional abilities, especially if you play sports or exercise, getting that back. It can be 6, 9, even 12 months until your knee really feels potentially like it did before. But the success rates, again, of that tendon healing from surgery, very, very good. Now, are there treatments out there that potentially could speed that recovery? Maybe, maybe not. And again, I don't promote regenerative and experimental and off-label treatments per se, but a lot of people ask me about them, so I do at least talk about them. You can check out more videos on the specific treatments and much more about what that means in terms of off-label or experimental with the FDA in other videos. But could something like BPC 157 or CJC 1295 with ipamorelin speed recovery? Potentially. Maybe the BPC might speed the healing of the quad tendon while the surgery is sort of holding it in place. That's certainly possible. Again, we have animal studies looking at tendon and ligament healing with BPC, not a lot of human studies, but in the animal studies, at least, it looks good. The CJC 1295 probably, and other growth hormone releasing peptides, not so much affecting the healing of the tendon, but trying to get the strength back around the muscles around the knee, and potentially it could play a role. Maybe regenerative treatments like platelet-rich plasma or like exosomes could also speed healing of the tendon, but with the surgery, maybe that becomes unnecessary. Again, I'm not promoting any of those, just answering a little bit about that or discussing those a little bit because I get so many questions about that. But quad tendon ruptures, very, very difficult injuries, very painful. Really almost always need surgical treatment if it's a complete tear, but the outcomes can be very good. It just can take a long, long time. I'd love to hear about your experience with your knee injury, especially if it was a quad tendon rupture. Leave those in the comments below this video. Just understand, I can't give you medical advice, but I do try to answer those questions in future videos. Please subscribe to my video channel. Click the bell to be notified when I release a new video and when I start a live stream like my Ask Dr. Geier live shows. If you have knee, hip, shoulder, or some other bone or joint pain and you want to get significantly better in the next 30 days without cortisone shots, without surgery, you can learn more about working with me in the description below this video. Thanks for watching. I look forward to helping you feel, look, and perform better than ever.